Hello, my name is Kelsey Davis. Welcome to my Institutional Review Board proposal. Today I will present a clinical trial surrounding the contribution to research on vitamin B12 deficiency anemia. The purpose of this research is to determine if vitamin B12 supplementation will improve cognitive function or brain structure in patients with untreated vitamin B12 deficiency anemia through a clinical trial. There is a significant need for this research, as noted in bullet 2, according to the Institute of Medicine. 75 to 90% of people with clinically relevant vitamin B12 deficiency have neurological disorders. In about 25% of cases, these are the only clinical manifestations of the deficiency. So let's talk about the role of vitamin B12 in the body. So vitamin B12 is a water-soluble vitamin, also known as cobalamin. Food sources are to the right. They include mostly animal products, dairy, fortified cereals, eggs, and shellfish. Vitamin B12 plays a role in cellular metabolism, DNA synthesis, energy production, and the development and function of the central nervous system. It also plays a role in a variety of other processes in the body, including the production of red blood cells. We know that the human body really only needs small amounts, 2.4 micrograms daily for adults, which increases to 2.6 micrograms during pregnancy and 2.8 micrograms during lactation. Deficiency can ensue in a variety of instances and can result in irreversible and potentially severe damage, especially to the nervous system and the brain. Vitamin B12 is absorbed in the small intestine, specifically the ileum, which is compromised in many cases, including patients that have had weight loss surgery or individuals with malabsorption with Crohn's disease or celiac disease. Deficiency can also ensue from dietary insufficiency. Because most of these foods are rich in vitamin B12 are animal products, vegans and vegetarians are at risk for deficiency, along with populations that don't have steady access to animal products. The most common cause of vitamin B12 deficiency anemia is a lack of a substance called intrinsic factor, which can cause your immune system to attack the stomach cells that produce this substance. So without the intrinsic factor, vitamin B12 cannot be absorbed and it leaves your body as waste. The main focus of this proposal is vitamin B12 deficiency, which occurs when red blood cells don't develop normally and are enlarged. Anemia caused by a lack of vitamin B12 is a type of megaloblastic anemia, where the unhealthy blood cell structure is abnormally causing the bone marrow to produce fewer red blood cells. Another marker for seeing if vitamin B12 deficiency is occurring is homocysteine levels, which rise as vitamin B12 status declines. There is a variety of literature that supports some part of the proposed clinical trial. The first is an early study in patients with pernicious anemia. I hope I'm saying that right. They reported an altered pattern of cerebral blood flow and metabolism measured by the nitrous oxide method. They observed increased cerebral blood flow with decreased cerebral vascular resistance in patients with severe anemia. And in contrast, patients with moderate to no anemia showed decrease in cerebral blood flow with increased vascular resistance. The authors found that cerebral metabolism improved but did not become normal following vitamin B12 therapy. This finding indicates that a portion of cellular damage may be permanent, which has influenced the population for my proposal. A population in the early stages of vitamin B12 deficiency anemia may show significant results for prevention. The authors noted that 2 patients who received early vigorous and continuous therapy for their disease had normal cerebral metabolic values and no mental defects. The next piece of literature that supports the proposed clinical study was a perfusion and diffusion imaging study focusing on the structural and functional changes in the brain after vitamin B12 supplementation. 100 micrograms of vitamin B12 was administered intramuscularly daily for 10 days. All patients had gait disturbance, sensory disturbance, mental impairment, and neuropathy. And after 6 weeks of appropriate therapy, both the mean serum vitamin B12 and serum homocysteine levels were improved. This study was a major step towards finding a correlation between homocysteine levels and anemia due to vitamin B12 deficiency. When compared with controls, patients with vitamin B12 deficiency showed significant alteration in cerebral blood flow as well, both in the gray and white matter regions. The results of patients varied, but neurological test scores showed a significant difference between controls and the baseline study patients. The last piece of literature was a clinical trial, also measured vitamin B12 deficiency, but in 24 dementia patients with additional symptoms of delirium. They focused on clinical changes and brain function using vitamin B12 supplementation. They went under repeated regional cerebral blood flow studies, psychiatric evaluations, and in some cases, patients took the mini mental exam or the organic brain syndrome scale. Following the clinical trial, 15 patients showed a clinical improvement and increase in general cerebral blood flow. In contrast, 9 patients who were severely demented showed no obvious clinical improvement and no general blood flow change. And although some regional flow increased, they were seen in sensory motor areas. They concluded that symptoms such as clouding of consciousness, disorientation, and clinical fluctuation responded to the vitamin B12 supplement. However, the conditions of dementia remained unchanged, and this study does present significant evidence for the future as patients with neurological dysfunction caused by anemia may be improved. After an independent t-test, it was determined that 100 patients are needed for this study. The participants of the study will be patients at a primary care office in Cheshire, Connecticut. To qualify for the study, patients must be 18 years or older, as the population is strictly adults, and they must have biochemical evidence of vitamin B12 deficiency anemia. Along with that, they should have no cognitive impairment or evidence of cognitive impairment, and they may not be on any medications that impact cognitive function. Upon entering the trial, a blood sample will be drawn to measure vitamin B12 plasma levels and homocysteine plasma levels. Patients will then be evaluated by a neurologist and take the Montreal Cognitive Assessment. And then the final step in the initial process is to undergo ASL, which is arterial spin labeling, to measure cerebral blood flow. Arterial spin labeling has emerged as a completely non-invasive MRI technique for quantification of cerebral blood flow. It uses magnetic labeling protons in the blood to provide a tracer of flow. The method has not been used yet for vitamin B12 deficiency. Patients will then supplement a high dose of vitamin B12 orally in the sublingual form, which promotes better absorption, for 10 weeks. The supplement will be given to each subject after the first round of spin labeling. After the 10 weeks, all subjects will receive an additional blood test to measure vitamin B12 and homocysteine levels again. The subjects will retake the initial exam, meet with the neurologist to be assessed, and they will then measure any improvements in cognitive function. They will undergo a second round of arterial spin labeling to measure any change in cerebral blood flow. The research team will then calculate the mean change in vitamin B12 and homocysteine plasma levels. The mean patient scores from the Montreal Cognitive Assessment will be analyzed for improvement or decline. The vitamin B12 and homocysteine plasma levels will be compared with the assessment scores to identify any correlation. The summarized qualitative data will include images of the brain and structure and matter from the arterial spin labeling. The team will then study any changes in cerebral blood flow and brain structure or matter. The study will show if vitamin B12 supplementation is correlated with improved cognitive function, improved anemia symptoms, and improved cerebral blood flow. It will also show if vitamin B12 supplementation is associated with any structural changes in the brain. Assessing the impact of vitamin B12 supplementation on patients with vitamin B12 deficiency anemia will provide more information on the role of vitamin B12 and cognitive function. The research is a step towards diagnosis and prevention of mild cognitive impairment and possibly dementia. The study will provide more insight for clinicians working in the field of neurology, bariatrics, and primary care. And it will also begin to close the gap between medical professionals and dietitian nutritionists and hope to benefit patient outcomes in all aspects of healthcare.